everyone, and welcome to the Pinnacle Journey show. This is the ultimate platform where we bring to you the inspiring stories of remarkable individuals through their extraordinary journeys. My name is Favor Santuanunu, and I'm excited to bring to you today's episode. This episode is proudly brought to you by Molex Foundation Africa, an organization committed to uplifting the next generation of individuals to lead, learn, and thrive in this environment. On today's show, we have with me, and I'm very honored to have with me this remarkable personality. She goes by the name Dr. Mrs. Joana Akorfa Amuzu. A little bit about Joana. So, she is a medical doctor, a midwife, a nurse as well. She has multiple careers in the healthcare field, and she has committed her life and dedication to healthcare excellence, to leadership, to mentorship, and she inspires many people. Let's go for a quick break. When we come back, you meet a very inspiring personality. Welcome back from that quick break. Let's get into today's conversation with Dr. Mrs. Joana Akorfa Mortoti-Amuzu. Doc, I'm so happy to have you on today's episode.
I'm also happy to be here.
Nice one.
Good afternoon to our viewers.
Good day to you all.
Thank you.
So, we want to know more about you. When we hear Dr. Mrs. Joana Akorfa Amuzu, who is she?
Dr. Mrs. Joana Akorfa Amuzu. It's a proud nurse, a midwife, and a medical doctor. I'm the fifth of 6 siblings. I'm a wife and a mother of 5 boys. I had my primary education at AME Zion Basic School, my secondary education at Holy Trinity Senior High School, popularly known as Hotcast in Accra. Then did my nursing midwifery and then proceeded to do my medical program.
Wow, that's actually very amazing. And you have had a very, very remarkable journey from nursing to midwifery. So what exactly kept you going? What was your motivation throughout your career from nursing to midwifery?
Becoming a medical doctor has always been my childhood dream. Like one day I wish to be a doctor, so it has always been a childhood dream. Then working at the medical field as a nurse, when I was a nurse, I worked with many doctors, nurses, and other allied health professionals. And the way the doctors carried themselves, everybody's role is important. I'm proud to be a nurse. Everybody's role is important, and the doctors are always in the lead. And I also wish to be in the lead. So that has kept me, it being a childhood dream, has kept me going.
Wow.
I want to reach there.
Wow. And you are there by the grace of God.
I'm there and I'm still going.
Exactly. That's right. Wow. That's very, very inspirational, having a childhood dream. Because usually many people like myself, sometimes when you have a childhood dream, you don't keep it and keep that dream going. So I'm very, very happy that you kept your childhood dream to become a medical doctor. Wow, that's so amazing. And I know the healthcare field has so many challenges and was very, very, I know it wasn't easy being the healthcare field. Can you recollect any challenging moments you might have had working in healthcare?
Yeah. A lot. The healthcare setting has a lot of challenges. Inadequate working tools to work with, inadequate, and then me transitioning from medical school, doing house job wasn't easy, very, very challenging. You work for long hours, sometimes 24 to 48 hours, which was not healthy enough. It was not healthy on our health. But fortunately, now that system has been reviewed. But this one is in some hospitals, not in all hospitals. My time, we're working long hours, 24 to 48 hours. So at a point in time, you feel like, should I pause, then go and rest for some time? But even when you go, you come back, you still meet the same conditions. But now those conditions have been reviewed. Then you also motivate yourself that people have passed through it. Then I can also, people have passed through it, they've survived. And I can also pass through it. And you speak to your senior colleagues who will give you tips on coping mechanisms, how to cope. But fortunately, like I said, it has been reviewed. So now you don't work for those long hours again.
Wow. I can't imagine working more than 48 hours
Very, very, without
continuously.
going home. You
Wow.
can imagine a mother and a medic working that long hours. It wasn't easy.
Wow.
But by God's grace, we've been able to pull through it.
Wow. That's so amazing. And you've worked at that for a very long time, right? For so
Yeah.
many years.
Yeah.
And so how would you differentiate the military healthcare from civilian healthcare? Are there differences that you can actually point out?
Okay. I will say what attracted me to 37 military hospital is the military discipline. The military discipline, I'm talking for my hospital. The military discipline, the senior colleagues there are competent. They are competent to train you, help you in your career progression. Everything is on time. Work starts on time. 37, we don't go on strike. We don't go on strike, unlike other
Wow.
places.
That
So
always,
I've not,
striking.
yes, I've not regretted being in 37.
Wow.
I have not regretted joining them for about 2 decades. I have
Wow.
not regretted it.
Wow. For 2 decades.
Yeah, almost about 2 decades.
Okay.
I was there and then went to school and then came back.
So you can
it's
see that
about
the things they are more smooth, the processes are more efficient.
Yes, that's for my hospital.
Of course.
Yes.
Wow. Okay, that's actually very amazing. And
The senior colleagues are there to motivate you in
Wow.
your career progression.
That's very, very inspiring. As a medical doctor with a strong background in medicine, do you believe that STEM, science, technology, engineering is very relevant to the healthcare field?
Very, very, absolutely.
What can you say about
STEM
it?
is very, very crucial in healthcare. Nowadays, everything in healthcare, you find its foundation in STEM. Like simple instruments, like the stethoscope that we use, to the complicated ones like the MRI machines, the CT scans. They help us in diagnosis of our patients, investigations, and then treatments. And then it also helps in this telemedicine. Helps in telemedicine. It also helps to provide services, medical services to remote areas. For example, the drone can provide medicines and then blood samples to the remote areas. So STEM is very, very important. Everything around us now is about STEM: science, technology, engineering, and mathematics. So it's very, very crucial. Everything has its roots, its foundation in STEM. So I will embrace young women to embrace. I'll tell young women to embrace STEM.
Thank you. And this even brings me to my next question. A lot of girls are afraid of the STEM field. They feel like it's too daunting and it's like a male-dominated field. So what advice do you have for young girls to come into the STEM field and take up careers in STEM? What advice do you have for them?
I will advise young girls, those who have the capacity to do it, don't shy away from STEM. You will not regret it. And I'll advise teachers and parents to encourage their girls, those who have the capacity to do STEM. They should take it seriously and then they will never regret it. They won't regret it.
They won't regret it. Yeah. So young girls out there, you have to take STEM seriously because from our doctor saying you won't regret it. Thank you. And we want to just know more about the Mrs. Joanna. I know that you're a mother of 5 boys. Yes. So how do you manage your professional life as a medical doctor and still have time at home for the kids, for your spouse? How do you manage these responsibilities? Are you overwhelmed? Do you have a support system? I want to know about how you do it. You do it so well.
It hasn't been easy, but by the grace of God, it has carried me through. I remember when I was going to medical school, I went with an 8-month-old baby, my fourth son. And then coming back, I gave birth to my fifth son in medical school. So you can see it hasn't been easy. Combining school, motherhood, and everything. But I have a support system. My family supports me a lot, my husband. And then even when I was doing house job, like those 24 to 48 hours. So I have the support system, and then you also need a good communication skills. If, for instance, I won't be able to come home or I have an emergency, have to call my husband, please pick the boys for me, because I close from work, I drop them at school. By 6:30 they are in school. Then close from work around 3:30, and then go and pick them because he is also at work. So, and then I have people in the house too who help me to achieve this, and I'm very grateful to them.
Wow. I'm also grateful to them as well for being such a very good support. Wow. So is there any advice? You said?
I said it hasn't been easy.
At all. I can just imagine.
It hasn't been easy. Sometimes you feel like, let me pause. Go and stay in the house for 3 months and then come back. The house job is waiting for you. The work is waiting for you. You have to move.
So doing this and succeeding, managing the two of them, what advice can you tell us that this is what I'm encouraging you guys to get a good support system? Want to know what exactly, how can someone out there who hasn't done this also achieve similar and manage both their school life and family life, professional life and family life?
You have to put yourself in it.
Wow.
You have to psych your mind. People have been able to do it. I have been able to go through it. The support system is there, good communication skills. So since I've been able to go through it, you can also go through it. You can also do it. I'm not the first, and I won't be the last.
True. That's very amazing. Thank you so much for that, Doc. And I know that you have gone a long way in your career. Can you say that mentorship actually helped you along the way? Did you have some people you were looking up to who were guiding you? And maybe you can name a few. And if possible, what advice do you have for young people out there who are looking for mentors? What advice do you have for them to find the right mentor?
As for mentors, I have a lot, from JHS basic through secondary, medical school, nursing, and even now, a lot of them, but I don't have their permission to mention their names, so I'll keep that one. I'm very grateful to all my mentors. Mentorship is very, very important. You need them to guide you, support you, and give you good counsel. Like in the medical field, it's like an apprenticeship program. It's like you are learning. So you need mentors that will guide you, support you. You learn at the feet of your senior colleagues. So you can't just be there that I don't need any mentor. You need them around in your studies, everything. So you learn at the feet of your senior colleagues. Mentorship is very, very important. So I will encourage young girls to identify mentors who guide and then support them and then give them good counsel.
Wow, thank you. So Doc is encouraging everyone out there to get a mentor. I have a mentor by the grace of God. And I know that I'm having a new one after this interview.
Sure.
Yes, thank you, Doc. We're going for a quick commercial break. We'll come back. We're going to dive more and deeper into Dr. Mrs. Joana Akorfa Amuzu's life and career. Stay tuned. Welcome back from that quick commercial break. If you just joined us, this is the Pinnacle Journey show where we bring to you inspiring stories of extraordinary individuals through their remarkable story. This episode is proudly brought to you by Molex Foundation Africa, and we also have our valued sponsors, Expert Innovation Company and AD Consults. Be sure to like, share, and subscribe to social media channels. We are Molex Foundation Africa across these channels. Also, if you'd like to know more about Molex is doing, visit our website at molexfoundation.org. Doc, thank you so much for your inspiration and your inspiring words so far. And I want to just know, young people are quite fearful when it comes to the medical field. There are some preconceived challenges that scare them away from coming into medicine. What advice do you have from them? Maybe drawing from personal experience, what can you tell them?
Yeah, I will advise young ladies. Medicine, it's a nice course, but you need to learn. They should take their studies seriously. Medicine is not a walk in the park. Yeah, and then they need some course choices. Think if you want to do medicine, you need your biology, physics, chemistry, and then the E-maths. But the biology should be there. So they should get mentors, like I said, to guide them in the choices that they will make if you want to do medicine. So you need some selected courses. You don't just do any course at all and then you will say, I want to do medicine. I've seen people who have done other courses I don't want to mention, and then they want to come and do medicine. You need some courses. So you get your teachers. If you want to do medicine, your teachers will guide you on the courses that you do. Then you have to excel, learn hard, take your studies seriously, get excellent grades, and then you come and join the noble profession. It's a nice area, but it's not a walk in the park.
Wow.
Yeah.
Wow, the noble profession.
Yeah.
It is indeed. Wow. Looking back on your journey, what impact and legacy do you hope for Ghana? What impact do you want to leave in Ghana?
Okay. The joy of every doctor is to bring relief to their patients. I remember one time a man came with urine retention. Just by passing a simple catheter, the man was just relieved, and then the pain, everything, the way he was screaming, everything vanished as if he
Wow.
had done, as if there was
A miracle.
a miracle. It was just a simple. So I hope to bring more relief to my patients, and then I have a growing list of mentees, which is growing. Yes, growing by the day. So I hope to be able to mentor them, all of them, by the time I retire from active healthcare practice.
Wow, wow. We hope that you are still with us for many years to come. Doc, do you have any future plans?
Of course. Of course.
Baby number
I'm still
6.
a student. No. I'm still a student, specializing to become otorhinolaryngologist.
Okay.
Yeah. So I'm still a student. I'm still in the process.
Wow.
Yeah.
Let's explore. What is that? What is that profession?
It's just ear, nose, and throat surgery.
Oh, okay. Wow. Okay.
Ear, nose, and throat surgery.
Wow.
Yeah. So I'm still a student in trying to become otorhinolaryngologist.
Are you currently studying? And which is it university in Ghana like to share?
Oh, it's a postgraduate course.
Okay.
It's a postgraduate course.
Okay.
I'm doing it in my department. My department is training people in that.
Okay.
Yeah.
Wow.
So I'm currently doing it at 37 Military Hospital.
Yeah.
The ENT department under postgraduate school.
Wow. That's very, very inspiring. Our viewers have heard you. We've heard about your inspirational journey through your career, your professional life, your married life. What last words do you have for our viewers, our young people out there who are looking up to you and who hope to become like you or even better? what words of advice do you have for them? Any last words of advice?
Okay, thank you. So, our viewers, my young ladies, I will advise you take your studies seriously. The ladies, don't let any man out there deceive you. Nowadays, social media, you can do a lot of things on social media, meaningful things on social media. STEM programs are there. You can do a lot of research on social media instead of using it to do awkward things. Use it to do meaningful things, and then look for mentors that will mentor you, guide you, support you, give you good advice. Then before you go to your mentors, I will advise you that you do some basic research before you go to your mentors. You don't just go raw like that. Do some basic research so that when you get to your mentors, the mentorship process will be a fruitful one. And then as a mother, a wife, and a medical doctor, I'm doing it. I'm still doing it. I'm still in school, and everybody can do it. I will advise you, don't give up, and you won't regret it. Take up STEM programs. You won't regret it. Thank you.
Thank you. Thank you very much, Doc, for sharing your inspiring story. And to our viewers out there, we've come to an end of today's episode. And here are the last thoughts I have for you. The road to success is not only about service, but also about healing. As we go about this road to success, not only do we aspire to save lives, but also help others do the same. Thank you very much, Doc, for sharing your inspiring story. And our viewers out there, let's keep leading, thriving together as young people. My name is Favor Santuanunu, and I've been your host for today. Until next time, see ya.
Bye.